This is Dr. Rajni Mandal with Pathology Watch, here with your 3D 3-minute digital dermatopathology digest. Today's topic is basal cell carcinoma. Basal cell carcinoma is the most common dermatological malignancy and is associated with chronic sun exposure due to UVB and mutations in p53 and the PTCH sonic hedgehog pathway. You can see here the two most common variants of basal cell carcinoma. Here is a proliferation of blue cells attached to the epidermis, as well as a proliferation of cells in the dermis. Let's take a look. Here you can see a proliferation of blue basaloid cells in the lower levels of the epidermis. There is peripheral nuclear palisading. You can see all the nuclei lined up against each other in a row. In addition, there is a stromal reaction. Here it's a myxoid, almost myxoid, stroma. Sometimes you can even see stromal clefting. This is superficial basal cell carcinoma. Many biopsies show more than one type of basal cell carcinoma in the same specimen, as seen here. This is a proliferation of blue cells in the dermis, and you can see these cells show also peripheral nuclear palisading. Sometimes the cell nuclei can be quite elongated. There is abundant proliferative activity in this nest. Here's an apoptotic body, as well as mitotic activity. This is nodular basal cell carcinoma. Here's an aggressive variant of basal cell carcinoma known as the infiltrative type. You can see here proliferations of blue basaloid cells forming infiltrative cords in the dermis. On higher power, these cells, again, sometimes show peripheral palisading as well as proliferative activity. There is also a stromal reaction. Another aggressive form of basal cell carcinoma is seen here. Here's the more regular nodular variant of basal cell carcinoma. And here you can see small little nests, rounded nests of micronodular basal cell carcinoma, an aggressive variant of basal cell carcinoma. If basal cell carcinoma is left untreated, it can be locally aggressive, as seen here. These are trabeculate of bone, lamellar bone with osteocytes, and the intralamellar space here is where bone marrow is usually located. You can see here that there are proliferations of infiltrating basal cell carcinoma, these basaloid nests forming infiltrating cords that are invading and located in the intratrabecular bone. Here's some more bone, and this is the basal cell carcinoma. So to recap for today, basal cell carcinoma is the most common dermatological malignancy associated with chronic sun exposure, UVB, and mutations in p53, PTCH, and SMO genes. It's a proliferation of elongated basal cells with peripheral palisading and stromal retraction. Common types include nodular and superficial, and aggressive types include infiltrative, micronodular, and morphiiform, and basosquamous. Other risk factors include Gorlin syndrome and nevus sebaceous. That's it for me for today. This is Dr. Rajni Mandal at Pathology Watch, revolutionizing pathology for dermatologists. Check us out at pathologywatch.com.